So for many years, we've been basing everything we do in the medical school on Halstead. So Halstead was a chap, he was a surgeon. He sort of was instrumental in founding Johns Hopkins in the US, and sort of the modern day model of the medical schools really after him. So the apprenticeship model, it's really stood the test of time. So see one, do one, teach one. We've all heard that. Kind of comes from Halstead, sort of well over 100 years ago. Now, while we've got the wonderful SimLab, simulated training and learning, and who knows what's going to happen with AI, it's really only an adjunct to the learning that we get at the patient's bedside. So how can we maintain this? And the challenges are trying to provide consistency of experience across a wide variety of learning centres. That's really hard, because we know that at the Royal Adelaide it's different to the Queen Elizabeth, it's different to Modbury, it's different to Port Augusta. We can't put everybody through the same thing all the time. There's only so much that we can do. So providing consistency is a really difficult challenge. Refreshing the curriculum, and importantly trying to determine what is relevant and what isn't, is a challenge that we fight with. And also the increasing influence of outside bodies, especially the Australian Medical Council. Now, for those of you who don't realise, the Australian Medical Council are like the overlords of everything medical in Australia. And they come around at great expense every few years and go, you're doing a good job, or you're not doing a good job. And then they give us conditions if we're not doing a good job, and say, right, by the time we come around next time, 2 weeks' time, you must have changed this, this and this. So they're called conditions. And there's about 8 sort of different categories that we have to sort of tick all the boxes with, and they'll give us conditions. And then we have to improve to the satisfaction of the AMC, the next time they come round. Now, can they close us down? Technically they could. They haven't to any other medical school so far, but they certainly keep us on our toes. And it's not, I don't know what Mr. Anthony thinks, but it's not impossible to think that the AMC is becoming more and more descriptive about what we should be doing and all the graduate outcomes. It's not impossible to think that maybe in 10 years' time they'll be telling us what the curriculum has to be, which would be kind of a little bit sad and a little bit scary, because then the government could say, all right, well, we'll do that in the first 3 years, and the medical schools can do the last 3 years, but I digress. The challenge is also in terms of medical education. From 4th year onwards, people are in the hospitals. We have to have a good relationship with SA Health. If we upset them, then it gets really difficult. And we've got a huge reliance. We couldn't do the job that we do without relying upon our clinical title holders. So, lectures. Is it a bit like Mad Max? At the end of Mad Max 2, kind of all washed up and nowhere to go. I think the lectures are perhaps seen their glory days and are probably heading into the sunset. But you have to realise that for many of the clinical educators or clinical title holders, so people who aren't employed by the university but do the teaching for the love of it, for many of them, probably my generation, maybe a little bit younger, but around this era, they really love giving lectures. It's the face-to-face that they love. They hang out all year to give their 1 or 2 lectures. So for them to say, for us to say, look, lectures are a thing of the past, write up some notes, and then we'll do small group discussion. It's a big thing, and we have to keep the clinical title holders happy, or else, we've got nowhere to go. So are our options predetermined learning material, which I think we're probably doing to a greater degree now, especially with the new BMST course. A lot of case studies and casework, and then group discussions. But even then, how many groups do you have? How big are they? Is Group A going to get the same experience as Group B when discussing cases? So there's a lot of things to work through. But at the end of the day, it requires a significant commitment from individuals who are really not employed by the medical school. So it's really hard. So, lectures, that's it, man. And of course, you'll all recognise that's Corporal Hudson from Aliens when faced with the onslaught. It's game over for lectures, I think.